He was beaten by Denis Istomin of Uzbekistan, who is ranked 117 in a match lasting nearly 5 hours. BBC News.
I spoke to the doctor and he said, "It appears you have a tumor." And I asked, "What kind of tumor? Is it a malignant tumor? What is it? What is it? What is it? What is it?"
Mina Schultz remembers the moment she was told she, a healthy 25-year-old, had cancer. I'm Philippa Thomas, and we begin this week's assignment in the American state of West Virginia, where we're asking what happens if President Donald Trump follows through on his pledge to repeal Barack Obama's sweeping healthcare reforms. Let's hear more of Mina's story.
He told me, the size of it, the location of it, and that it was likely malignant. I was home alone, and that was hard, calling my mom and asking her to come home from work.
It came out of the blue. I mean, you were healthy before?
Yeah, I jogged every day, so they said, it's probably a running injury, so don't worry about it. Rest, ice, elevate. But the swelling didn't go down, the pain didn't go away, so.
You think in your 20s you should be immune to that kind of thing? It shouldn't happen to you.
When they said, "You'll be glad you came in," when I was leaving the MRI, I assumed I had, a torn ligament or something. Never even crossed my mind. All of your plans for the future go out the window. You kind of become frozen in time. It just stops. Things kind of halt.
Mina had been going places. She'd travelled in Europe, done a master's degree, and was about to join the US Peace Corps. Now she was home in Fairmont, West Virginia, with a malignant tumour in her knee. But her family had signed up for insurance cover under the Affordable Care Act, known as Obamacare, which became law in March 2010.
I heard from my parents there's this new law that lets you be on your parents' insurance until you're 26. And they were like, "Why don't you join our plan?" So I said,
and you
yeah.
were just inside it.
Yeah, I said, yeah, sure. I don't really need insurance, but if it's that easy, then sign me up.
And you really did need the insurance. Tell us what you went through.
It was 5 surgeries, including a total knee replacement surgery, a year of chemotherapy, and a lot of medications. So a lot of hospitalization, a lot of medications, lots and lots of money spent.
Do you see the bills? Do you have an idea of what that kind of thing costs?
It was a couple $100,000. I didn't see the bills. My parents, I saw them in the beginning, and I was in a lot of distress, but I did see the price of one of my injections once, and that upset me a lot. It was a couple $1,000s.
For an injection?
For an injection.
To many, those sort of costs seem crazy. The system seemed broken. But did Obamacare mend it? The very word divides America. It did make big changes, shaking up the traditional view here that healthcare should be a service most adults choose to pay for, not a service managed by government. Len Nichols is Professor of Health Policy at George Mason University in Virginia.
Well, the first thing I would say to your audience is, remember, America believes in individualism and libertarianism, and everybody's on their own. We don't have the same solidarity consciousness that Europe does. And so we believe you should get it on your own, and most of us do get it through our employer. We subsidize that through our tax code. We allow the employer contributions to workers' health insurance to be tax-free, both for the firm and for the worker. So it's quite a bargain. And so 70% of us get coverage that way.
But what about the rest? There's always been emergency treatment for what are called the 3 Bs, breaks, bleeds and birth, and 2 safety nets, Medicare for the elderly, Medicaid for the poor.
No insurer wants to cover someone. By definition, they're risky. So they found the insurance market didn't work for them. And so we said, okay, fine, we'll do a British-like payroll tax-based system for the elderly.
And that's Medicare.
That's Medicare, and that works fine for everybody over 65 and the severely disabled. Then we said, okay, then there's the poor. And they couldn't afford health care, of course, on their own. And what we found was, if we subsidize their access to insurance, then that insurance can pay providers to cover them, and so basically that's what we do.
Obamacare was aimed at around 38 million American citizens who still fell through the gap, mostly low-paid workers. President Obama and the Democrats in Congress pushed through a big expansion of Medicaid for tens of millions at the bottom of the income ladder, and they provided subsidies to get those on the next rungs up into a new marketplace, the so-called insurance exchanges. In the Trump-supporting state of West Virginia, with one of the poorest, unhealthiest populations in North America, the thousands who signed up get some of the biggest subsidies in the nation. Many also benefit from the fact that Obamacare stops insurers from doing what they naturally do, charging high-risk customers more, even turning them away.
Before the Affordable Care Act, if you have a pre-existing condition, they can charge you higher rates, they can drop you whenever they want, or they don't have to insure you at all. With the Affordable Care Act, they got rid of the pre-existing condition clause, so now all insurance companies have to accept you regardless of your medical history. Benefited from that, to say the least.
That just being a woman also used to be a pre-existing condition that could trigger much higher payments. The ACA ended that, and it provided free access to essential women's services like contraception and maternity care. But with benefits come costs, of course. I asked Mina what hers are.
I've been paying about $400 a month, but this year, 2017, I qualified